computer. Okay, so I think it's recording. We'll see. Okay, so I am going to go ahead and get started, and we do have a brochure that kind of summarizes both these Social Security and Medicare information that I'm going to cover, so I can mail that out to anybody that wants that. And why is this not moving? Okay. So the things that we are going to talk about today that people need to know about Social Security is you have a lot of different claiming options. The decisions that you make today have consequences for the rest of your life. So we always want to make sure people really consider everything on whether to, take the benefit early and take a penalty, or wait a little bit beyond retirement age and get a bonus. And that really depends on individual situations, but the choice impacts both spouses. So it's important that people really thoroughly look at this. And then we have, there's a lot of people that think that it's the system is going bankrupt. It is not going bankrupt, but and it's not a Ponzi scheme. But we'll cover what maybe some changes need to be made, like they made back in the 80s for the baby boomers, where they increased the age from 65 for normal retirement age up to 66 through 67, depending on the years that people were born. I think most people know that benefits have helped family members. Not only is Social Security a retirement benefit, but it can also provide disability and a very small death benefit. And there's benefit for survivors and for people that get divorced. We'll cover all of that at a high level. And then we always like to say that people's friends are not experts. I've got this book that it comes out every year that I subscribe to this service, and Social Security is complicated, and you should make sure that you go to somebody that can help you look at all your options, rather than just taking what your brother-in-law or a friend or neighbor tells you that you should do. So some of the reasons that it's so important for women, as that women live an average of 5 years longer than men. So we need to cover more years of retirement, and the potential cost of healthcare is higher. Women reaching the age 65 have a 25% chance that they'll live to age 95. The population over 85 is the fastest growing segment of the population. And women often have less in retirement savings because they're the primary caregiver, often unpaid caregivers of elderly parents. Often women leave the workforce to raise children or to care for spouses or parents. And not that there's anything wrong with that. That's a personal choice, but it does impact your Social Security benefit. And that's why I like to do these workshops. And I wish I could be there in person and have it be more interactive. But if you do have questions as we go through this, you can feel free to unmute yourself and ask a question. So baby boomers in particular, people born between 46 and 64, used to think that Social Security wasn't going to be there for them. But when they first started turning 65 about 10 years ago, they started wanting to know, when should I apply? How can I maximize it? Is it going to be enough to live on in retirement? Which I can answer that for you now. For most people, no, you would be living below the poverty line. But is it something that will be a part of your retirement? Absolutely. And that's what we'll be looking at tonight. So the first thing I want to cover is just how Social Security works. The trust fund balance on December 31st of 2018, just a little over a year ago, was $2.9 trillion. In 2019, the total income brought in by people working was $1.062 trillion. Total expenditures going out to pay beneficiaries was $1.059 trillion. So the net increase in assets was $3 billion. So it is slowly increasing over time, but it's a system that is meant to pay workers, have workers that are working, paying in, and the beneficiaries receiving benefits that are actually in the system and likely no longer working. The long-term projections, without any reform, everything stays the same as it does today. They would, the benefits would fall to 80%. So if you were eligible for $2,000 a month, you would still get 80% of that in 2035. It's not expected that it would drop to 75% until the year 2093. But because we are a population that is living longer, one of the things that is important to look at, and that Congress, nobody in Congress has been brave enough to do since they made the changes in 1980, are to increase retirement age again. It's very likely it could for the millennials, which is a generation as big as the baby boomers, bigger actually. If they raised it by a couple of years up to age 70, that would shore up the system. One thing they have consistently done is increased the amount of money that is subject to Social Security taxes. So all of those things are possibilities, and at some point they may do some level of means-based testing, where if you have saved enough that maybe you have to wait an extra couple of years, or you can't, they push your normal retirement age from 67 to 69 or 70. Any combination of those things could shore up the system even more, but it's definitely going to be there in some shape or form. So this is currently, we pay 6.2% on every dollar you earn, up to $137,700 for this year. And the I've already talked about raising the normal retirement age. They could increase the maximum. Right now, people that, no matter how much you make, you have to pay an extra 1.25% in Medicare taxes, whether you make 137 or $1 million. So and that's matched 1.45% matched by your employer. And for those of us that are own businesses, we pay both parts of it. So the other option is that they may reduce cost of living adjustments in the future. So if you're a baby boomer, your benefits are not likely to be affected. Even if you're Gen X, not likely to be affected. Millennials, definitely. So what's a better way to think about Social Security? It is an inflation-protected income stream. And as I was saying to Larita when she first came on the call, you paid a premium in every paycheck since the first time that you ever worked. So, you want to be smart about how you collect the money that you paid in for all these years. And I think it's important to look at, sometimes people will say when we're doing a retirement plan, oh, I'm only going to get $2,000 a month. That's not that much money compared to what I need to live off of. But when you look at it from the capital that you would have had to save on your own, to receive an income of $2,000 a month that for 30 years, which many people are going to live 30 years in retirement, you would have to accumulate, as it shows here, $1,070,000 to create the equivalent of $2,000 a month over 30 years. So it's not chump change by any means. And I think when people look at it, that you know, you would have had to save that money on your own, or had a lump sum of $1 million available to be able to have that $2,000 a month. It starts to put things into perspective. So you are saving, and your employer is helping you by matching that social in the form of a Social Security tax. So, and this just shows in in 10 years, if you continue to get, the average cost of living has been 2.6%. That's why we use that number. But that is, your benefit would be $25.85 in 10 years. And by 30 years, it would have more than doubled to $43.20. So that is, if you are eligible for a corporate pension, which most people aren't anymore, they generally, if you have $2,000 a month, it stays at $2,000 a month for your life. For people that have government pensions, you might have a built-in cost of living. So how much can you expect to receive? It depends on how much you earned over your working career and the age at which you apply for benefits. So how they calculate at age 62, it's just a, before age 62, it's just a guesstimate, but they actually, at your age 62, look at your highest 35 years of earnings. And then, I'm not going to get into the bend points. There are, you know, there's a formula that is attached to this. And then they go back and look at, if you were making $12,000 a year in 1980, and that would be the equivalent of, you know, $24,000 this year, they're going to adjust that for inflation. So they're not just using the base dollar amount. And the other thing that's really important to understand for people that left the workforce is that if you have zeros, if you didn't work 35 years by the time you're 62 and you're making a good income in your 60s, it can make a substantial difference in how much you can collect, because you would be replacing zeros with actual earned dollars. So when people ask, does it really make a difference if I work 3 more years or 5 more years? It could make a huge difference. So I'm gonna skip these formulas. There are a lot of numbers, but we will, everybody that signed up for this has the opportunity to come in and get a social, or we can do, virtual in this COVID-19 environment. People were coming in, but we are happy to provide and can do a meeting like this, where you could actually see how your Social Security benefits and your spouse, if you're married, play out. So this slide is just saying, you know, why shouldn't I claim at age 62 and instead of delaying till age 70? And, you know, a lot of times there's many reasons for that. Sometimes people are under the impression that it's running out of money and they're not going to get it. They better sign up as soon as possible. But the reduction or the penalty for that can make a huge difference in your future. And delaying to full retirement age 70, as I'll show you in a couple examples, just to give you an idea, it can make a huge difference in your lifetime income stream. And if you're married, it can even make more of a difference, especially if one spouse was a more substantial or higher income earner than the other. It can make a big difference there. So I think one other thing that I want to make sure and point out is, not only do you reduce your monthly income if you claim early, but once you are eligible for Medicare, they take your Medicare premium out of your Social Security. So if you have a reduced amount, Medicare is going to take up a much larger percentage. I think I have that on the one of these slides. So it's not I'm not saying everybody should wait until they're age 70. Certainly, I've had examples of people that wanted to retire at 62 just to start taking their Social Security, but they couldn't pay their living expenses with it, and they didn't have the opportunity to work part-time. So need for income is a big reason that you would not take it at age 62. If you've saved enough and really don't need it it's not going to make a substantial difference, then you may consider taking it early. Your life expectancy should be taken into consideration, and your health status. Also, survivor needs should be taken into consideration, because if you have a spouse that is ill and was the higher earner, if he can or she, depending on who the high earner was, I don't want to be presumptuous here, because a lot of females out earn males these days, so it's just spouse in general. When one person dies, you only get one Social Security payment. So if you can maximize the higher amount, then it's better if you can get the higher earner to wait till age 70. And I'll give you some examples of that. So I think I already said earlier, Social Security is rarely enough to live on. Full retirement age, if you are a baby boomer, here are the ages of full retirement age. People that were born 1960 or later, the age has increased to age 67, up from 65. And this shows the percentage. If your full retirement age is 67 and you apply at age 62, you will get a 30% penalty off of what you would have received at full retirement age. That's pretty substantial when you project that out over the lifetime of your earnings, or collecting of those earnings. And for people that, for every year that you wait, you can get an 8% bonus in delayed credit. So it can make a substantial difference. I'm gonna send everybody a copy of this Social Security brochure. If you just email me your address where I can reach out and email, and we can mail it to you. So I'm not going to, you'll have this information sent to you. And, you know, this just is an example of, you know, if you took your benefit early at age 62 and you only, you started out at 1960, by the time you hit age 70, you would have received almost twice as much, or $34.72. The right column is showing if you assume that you not only have a primary insurance amount, that's what you would get at normal retirement age, but they include the 2.6% cost of living, then that could grow all the way to almost $4,300. So literally almost double the benefit. So if the main point, I know this is a lot of numbers, but the main point that I'm trying to make is it makes a big difference. And this shows if you claimed at age 62 versus 70 and lived to age 95, look at that difference there. You'd be getting $4,500 a month rather than $8,000. And if you don't have a huge nest egg, that right there is a great reason to wait. So, you know, you want to make sure and look at your earnings record. If there's any missing years that you know you worked, you should reach out to your employer and get that straightened out. Everybody should be receiving a Social Security statement. And if you're not, you can go to ssa.gov and order a statement directly from them. They have a pretty strict security to get in. But when you are applying for Social Security, this is one of the things that we look at is, how's it going to affect your income needs now versus if you wait till age 66 or 67 or 70, depending on what year you were born. And then again, looking at your life expectancy and your spouse's. As an example where we encouraged one of our clients to take her benefit at age 62, her husband was very sick and had cancer and was on disability. So he was collecting his full retirement benefit and wasn't expected to live more than a couple of years. When she turned 62, we encouraged her to go ahead and apply. She was only working part-time and she didn't really need the money, but it allowed her to bank the money because when he died, she would have been eligible for his higher benefit, but it wouldn't have made sense for her to collect her own because they look at the higher of the two benefits. So just quickly, there is an earnings test if you start to take your Social Security before normal retirement age, whatever that is for you. So let's just say it's 67. Between the time you're 62 and 67, $1 in benefits is withheld for every $2 that you earn over 18,000. So basically, if you're earning $45,000, $50,000 a year, you would totally wipe out your benefit anyways. So some people, that's just, they can't afford to retire and they make too much money to be able to take Social Security and still work. So I always tell people not to let the earnings test discourage them from continuing to work if you need to shore up your retirement plan. And especially with what's going on in the world, with the stock market dropping dramatically, a lot more people are probably that maybe were thinking about retirement might need to work a few more years. Social Security benefits are taxable. A lot of people think, well, I've already paid taxes on this money, but almost everybody that we work with has 85% of their Social Security is taxable, because if you jointly earn over $44,000, then, and that includes, they look at adding 85% of your, half of your Social Security benefit to your adjusted gross income to determine that 44,000. So again, you don't have to get caught up in the numbers, but know that it's likely that 50 to 85% of your benefit will be taxable. So there are, there's some way to minimize taxes on Social Security benefits that can be done proactively while you're still working. One is to delay the Social Security. We've talked about that. If you can pay down your debt and reduce your expenses by the time you retire, that's going to help to maximize your benefits. If you don't need to earn as much, it's just that much less that you would need to take out of your portfolio. So we work with our clients in managing their taxes throughout retirement. This is what I was referring to. Medicare Part B this year is let's call it $145 a month. If you started taking your benefit at age 62, then Part B takes up 8% of your total Social Security payment. If you waited till age 70, Part B only takes 4%. So that's a 50% cut in what your Medicare Part B benefit represents, and everybody has to take Medicare Part B. If you if you don't want to be, have an open-ended liability that could bankrupt you. So here's some of the key points to remember in Social Security, that if you apply early, your benefit starts lower and stays lower for life. The cost of living adjustments, as long as they are still being done, which they have been being done since the 70s. It's, the longer that you live, the more beneficial these cost of living adjustments are, as you saw on that slide, where, if you live to 95, you'd have almost 8,000 versus 4,000 based on that example. And please don't let the earnings test discourage you from working. And I think one of the most important things is the delaying benefits gives the surviving spouse more income. So I wanted to give an example of, for couples, why you should maximize the higher earnings benefit to protect a surviving spouse. I'm not going to go through all these examples, but I think this is a good one. The spousal benefit, when you are ready to file for Social Security, they are going to look at your earnings record and your spouse's, and you will qualify for half of your own benefit, half of your spouse's benefit, or your own benefit, whichever is greater. So this example, if John's primary amount was $2,000 and she had earned enough to get $800 a month on her own, if she applied at full retirement age, she would get $1,000 a month rather than the $800. So that's an important point to understand, that you get yours on your own merit or half of your spouse's, whichever is greater. In order for a spouse to have filed, to file for a spousal benefit, the primary worker must have filed for benefits. So your spouse has to have filed in order to be able to get your spousal benefit. And you have to be at least 62. You can't, and you will get a reduced benefit, but you can't apply at 61 or 60 just because you want to, even if your spouse is 5 years older. You have to wait until you're at least 62. And you do not get any delayed credits on the spousal benefit. So if the husband in this example, John, had waited in 4 more years and gotten additional benefit, Jane would not have had an increase above half of the 2,000. It's cut off at that point. So that's an important thing to remember. And this is the example where if the lower earning spouse's primary insurance amount is more than 50% of the higher earning spouses, then both spouses could delay till age 70, or at least one spouse can take advantage of the spousal benefit. So there's a higher death benefit, is basically how that works. So we can do that analysis for each of you if you're interested in having that done. I don't want to spend a whole lot of time looking at each and every example, but I'm happy to do it one-on-one. So this is just for people that are widowed or divorced. You may be eligible for survivor benefits, divorce survivor benefits, or divorce spouse benefits that can increase your monthly check. So that's just an important thing to remember. If you are fall into that category, then we could talk one-on-one and show how that would be affected. So I do want to point out that for divorced spouse, if you are divorced, these are some of the rules. Marriage has to have lasted 10 years. You have to be currently unmarried if you're trying to receive divorced spouse benefits. Your ex-spouse has to be at least age 62. And as long as the divorce, this is one thing that's different. on your ex-spouse. If the divorce was not more than 2 years ago, your ex-spouse does not need to have filed. If you're married, your spouse has to have filed for benefits to get the spousal. If you're divorced, they've made a special rule because sometimes divorced women tend to not be in as good of financial shape as their married counterparts. So that's an important takeaway. So bottom line is we look at all of these individual situations when we meet one-on-one and provide this free Social Security analysis. I've seen so many people make mistakes over the years that from our standpoint, and I think I know Larita knows, but I didn't even introduce myself at the beginning. I am Kathy Fish, and I am the founder and president of Fish & Associates. We're an all-woman financial planning firm, and I've been doing these Social Security and Medicare workshops for many years. I've seen so many women make mistakes or let their spouses make decisions that severely negatively impacted their future, that that's why we offer a free one-on-one session. People may not need to hire us to do a financial plan, but if we can open your eyes on why you at least want to take this into consideration and look at what your options are, it could really make a huge difference in your future. And I give you an example. I had a nurse attend one of our seminars that had been at Methodist Hospital for 30 years, and she made very good money, and she wanted to retire and start Social Security at age 62. And when she came in to talk to us, I pointed out that I asked her if she had enough money to retire, and she didn't, but she said I can always go back to work. And I said, well, if you give up a job that you've been at for 30 years, you have seniority, your pay has gone up with cost of living, and nobody else is going to hire you in your 60s at that same rate if you decide you want to go back to work part-time somewhere else. And she saw the light and, avoided making a very expensive mistake for her future, and just had to realize she had the opportunity, even though she was tired of working there, it was the opportunity to really shore up her savings and get her house paid off. There were some things she could do if she worked about 5 more years, and, it may not be what you want to do, but, you just want to put yourself in the best financial position possible. So, people are hurting their retirements by making these costly decisions. And if there's some key insights that I want you to take away is Social Security offers inflation protected income that you can't outlive, including benefits for survivors. Your monthly benefit will be reduced if you claim early. You're penalized for that. I think I've kind of pointed home that couples should always maximize the higher earning benefit for the surviving spouse, again, based on their financial situation, but it almost always is beneficial because the drop off of one Social Security at death can be very very devastating if you haven't saved properly. And for people that are widowed or divorced, they may be eligible for benefits that they weren't even aware of. We have found that when people came in and had no idea they could collect off of an ex-spouse's a spouse predeceased, and they never remarried, and they were eligible to get a survivor benefit and let their own benefit increase up to that, get that extra 24%. So there are definitely some good strategies that you can use. So I'll be reaching out, or Lauren, our office admin, to all of you that have attended, and just see if you want to set up. All we need is a Social Security statement to do the report. And then we can have a personal Q&A if that is something that you're interested in. So what we will at a high level be looking at Social Security in context of IRAs and 401ks that you have, your investment portfolio, your work, your salary, any pensions that you're eligible for. So all these, there's many moving parts to consider. And, you know, Social Security can estimate your benefits and tell you what you're entitled to, but they really can't project future benefit scenarios. They're not supposed to be giving that type of advice. And, you know, that's what we do for a living. So we can help people strategize to maximize their benefits. So if you have, after watching this, if you have any of these questions, when should I apply? Should I keep working? What if I already applied? There are ways to unwind that. We've had people that just started at 62 that really had the means to not have started. And if we catch it early, you could pay the money back to Social Security and sometimes use some of your other assets to build that benefit up at least till normal retirement age. You could get 25% more. So that's substantial. And we are here to help with that. So we're trying to make sure people know this is too important for it to be guesswork. So anyways, that really concludes this portion. Does anybody want to chime in with any questions before I move on to Social Security?
I have a question, Kathy.
Okie doke.
This is Larita.
Hi, Larita.
Yeah, could you just clarify between the 62 age and the 67? So are you saying you would apply at 5 years before? If some people are doing it at 62, they would do that 5 years before they're taking any benefit?
No, if they take it at 62 instead of 67, then they're going to get a 25% penalty on what they would be eligible for.
Okay, so the two ages are 62 and 67, and then you mentioned age 70.
Yes, age 70 is where if you wait, let's say, and it's somewhere between 66 and 67, depending on what year you were born. So let's just say you were born in 1961. I'm just making this up because that would be where age 67 would be your normal retirement age. If you wanted to start taking, and let's say, I'm going to use this for ease, that your benefit was $1,000 a month. If you were to start taking it at age 62, you would only get $700 a month. It's actually a 30% discount. If you waited till age 70, for every year that you waited, you get another $80. So instead of getting $1,000, you would get $1,240. So now you've changed from, if you took it early, it'd be $700 a month. If you waited till age 70, you would be at $1,240, and that's without taking any Social Security cost of living adjustments into consideration. So think about it more as normal retirement age is when you get the full amount. If you take it before, you get a penalty. If you take it after, you get a bonus. Does that make sense?
Got it. Yeah, thank you.
All right. So now we'll do a little bit on Medicare. And where is that? There it is. And again, I'm not going to go through all of these slides, and it probably will only take me about 20 minutes to go through here. I want to give you the high-level basics, and again, any specific questions we could go over one-on-one. This is the National Health Insurance Program for people age 65 and older. it is, you enroll through the Social Security Administration, but it's administered by the Center for Medicare and Medicaid. You have to wait until you're age 65, unless you're disabled, to qualify for Medicare. So that's why another place where people get confused. You don't, if you wait till age 67 for your full retirement benefit, you can still apply for Medicare at age 65. So who is eligible for Medicare? Everyone over the age of 65 that is a U.S. citizen or legal resident if you've lived in the U.S. for at least 5 years. And as I said, and there are, if you qualify for Social Security disability, you may be able to get your Medicare benefits prior to age 65. There's 4 parts of Medicare. I'm going to concentrate on Part A, B, and D tonight. Part A is your hospital. Part B is your medical, that covers doctor office, outpatient, and D is for the drugs. Now, in your group health insurance, that's all bundled into one program. You usually do have a drug card, but you have hospital insurance you don't pay anything for as long as you worked 10 years, 40 quarters. Part B you have to pay for, Part D you have to pay for. And if you don't take it, you get penalized. If you don't take it when you're eligible, you get penalized for each year that you wait. So the I'm not going to go through this in great detail, but there is a Medicare Part C that acts more like a PPO or an HMO that collapses all this into one, but it can be restrictive. So most people pick the original option of getting Part A, B, and D. So if you are still working and you work for a company that has 20 or more, under 20 employees, you have to enroll in Medicare when you turn age 65. If you work for an employer that has more than 20 employees and you're continuing to work, you don't have to file for Medicare Part A, but a lot of people do because it's free, and it could possibly cover some things that your group health insurance doesn't cover. So what happens if you don't enroll in Medicare, you pay late enrollment penalties, and your healthcare expenses may not be covered by your insurance. If somebody forgets to file for Medicare and they work for a small company and they get sick, their health insurance can say, you're over 65, you should have filed for Medicare. So you want to make sure that private insurance can cut you off if you work for a small employer at age 65. If you're receiving Social Security when you turn age 65, Medicare and A and B are both going to be automatic. You can decline if you don't want Medicare Part B, but yeah, that's just not a good idea. One reason you might is if your spouse is still working and you're covered by their plan, then you can wait for Part B without being penalized. But all this doesn't happen until you're age 65. Part D is not automatic. Your drug card, you have to sign up for that. And it really depends on what type of drugs that you take. So if you are not receiving Social Security at age 65, then you must sign up through the Social Security Administration during the Medicare enrollment period. And the initial enrollment period is if you're not covered by a group plan at age 65, then you apply. And then there's a special enrollment period if you are covered by a group plan at age 65. So if you're doing something you like and you want to keep working, you don't have to apply for Medicare Part B until you actually stop working, and you're not going to be penalized for that. They just want to make sure you're covered by somebody else. Just so you know, if you're not automatically enrolled, there is a 7-month period. You can enroll in Medicare Part B 3 months prior to age 65, the month you turn 65, and 3 months after. So there's a 7-month window that you can apply for that benefit. So, most people are going to sign up when they turn 65, no matter if they're working for a large or a small employer. But the Part B is, really, since you have to pay for it, there's no reason to pay for it until you actually need to go on it. So who does need to sign up for Part B during the initial enrollment period? If you're not working anymore, you need to sign up for it. If you're self-employed, you need to sign up for it. If you work for a small company, you need to sign up for it. If you went on COBRA from an employer and you turn 65, COBRA goes away at 65, and then you need to enroll in Part B. And if you are employed by a company, so if you have a health plan that's not as comprehensive as what Medicare Part B covers, then you would want to go on that as well. So, and Part D, you need to sign up for that when you're first eligible, or you'll face an enrollment period, and that follows the same type of protocol that Part B does. If you're still working or you're covered by another plan, you don't have to take it. But if you choose not to take it because you're not taking any prescription drugs, and then all of a sudden you have to start taking drugs, then for every year you waited, you're going to be penalized for the rest of your life. So I always encourage people, even if they aren't on taking medications now, to at least sign up for a basic plan. So the best time to enroll in Medicare to avoid these penalties are, before your current coverage ends, really. That's what I always recommend. If for some reason you miss the initial enrollment period, there is a general enrollment period from January through March of each year, but then you don't have any coverage. If anything happens to you between the time you sign up and July 1st, you're out of luck. That coverage doesn't go into effect. So the main point here is Medicare is not something that you ignore. It can be complicated when it's time to sign up for it. You just don't want to be late. You want to do plenty of research that year or two before you're qualified for it. And some of these rules could change down the road, but it's never changed that you have to be age 65. And I don't really anticipate them increasing that. Changes in Social Security, yes. Changes in Medicare or reducing the age for Medicare, very unlikely. Very unlikely. So I'm not going to cover the particulars. This shows you, you go to ssa.gov to sign up for A and B. One thing I do want to say about Medicare Part D, and this could be if you're far away at this point from being on Medicare, but let's say your parents are. The statistic is something like 80% of people are paying too much for their Part D. They allow you to change that plan once a year, and protocols change with different insurance companies for different drugs. And that is, you could save substantially from year to year. But a lot of times I ask my clients if they're going to check the protocol and see if they can save money. And some people are just like too lazy to do it. But if you're paying a lot for drugs and you have a lot of out-of-pocket costs, it can be worth looking into. So I encourage that. Now, Medicare and private insurance. The thing that a lot of people don't understand also is that Medicare A and B don't cover everything, and D. You've got other out-of-pocket costs, there's deductibles, there's portions of your doctor's bills that aren't covered, services that aren't covered by Medicare at all. And unlike your private group insurance, if you have that kind of insurance where there's a cap, you know, the most out-of-pocket you would spend might be $2,000 or $3,000. This is open-ended if you don't get a Medicare supplement. You will owe 20% on your entire bill, up to $1 million, up to however much it could cost. So getting a Medicare supplement is extremely important as well. So if for some reason, and I've only come across this once, had one client that didn't meet the 40 quarters of work, so she had to pay Social Security, and she was paying $458 a month. Her husband was 12 years younger than her, so until he turned 62, and now she's in her 70s, she finally is getting free Medicare Part A under her spouse's insurance. And then Medicare Part B this year is $144.60, and then Medicare Part D varies according to the plan. But for the majority of people that worked or have a spouse that worked and they're close to the same age, you're not going to pay anything for Part A. This is a busy slide, but just know that there's surcharges that are added once you reach certain income levels. So people that earn over, have joint income, you know, between 175 and 218,000 are going to have to pay an extra $70 a month on their Part B, and it goes up with, so people that are very wealthy, they're paying $600 a month instead of $184. So that's a way of means testing, just saying if people have that kind of income, they can afford more, and those premiums go back into the system. So that is, this is the deductible. You've got a deductible for Part A and B, and a deductible for Part D. They change every year and it goes up. There's certain preventative services that are covered as well, like pap smears, mammograms, flu shots, those types of things. And then another big misunderstanding with people is that Medicare does not cover nursing home. If you have to go into a nursing home facility for rehab, it will cover it for up to 20 days. After 20 days, you pay $176 a day, and you've got a lifetime benefit of 100 days. And if it's not skilled care, if you're not going in for rehab, they pay nothing. So just want you to be aware of that. They cover 100% of the first 60 days in the hospital. They get people out of the hospital so quickly these days. That's not really something that you have to worry about. But here's the thing that Medicare does not cover. Long-term care, which I just discussed. If you are in a nursing home needing help with the activities of daily living, this is not going to be covered. If you live outside the U.S. or something happens outside the U.S., Medicare does not cover that. It doesn't cover dental. It doesn't cover vision. It doesn't cover hearing aids, which are very expensive. Cosmetic surgery, most alternative medicines, it doesn't cover, even though they tend to help and are less expensive than a lot of medical procedures. Anything that isn't covered by deductibles and co-insurance. So this is why you want to have a Medicare supplement, and they will fill in a lot of the gaps, but not all of them. Medicare supplements don't pay dental and vision. So it's these Medicare supplement or Medigap policies are, they're pretty standard plans. Back when I first started in the 90s, people would have multiple Medicare supplement policies, and only one of them would pay. So they were paying all these premiums. Well, back in the early 90s, they came in and regulated that and said, everybody that offers Medicare supplements can offer, these plans between A and N. And if you are looking at 4 different insurance companies at Plan J, they will all offer the exact same benefits so that you can actually pick based on premium. So, and costs do vary by the company and the location in the country that you're in. Not going to cover Medicare Advantage. There's a lot of considerations that need to be taken into things that have to be taken into consideration, like what drugs do I take? How much will each of these plans cover of those? That will, how strong is the insurance company? So you want to look at all of these things. And on the Medicare supplement, not D, but for the basic health care, if you don't, it's guaranteed issue as long as you apply within that, 6-month window, 3 months before and 3 months after the month that you become eligible. That is, they have to take you no matter what. And you can change insurance companies as long as you're healthy, but once you develop an illness, an insurance company can turn you down after the initial enrollment period. So that's my biggest takeaway for people with that, is that's an important decision, and you want to make sure you're with a good insurance company. Final word about healthcare costs, because this is one of the biggest things that we see people not taking into consideration, and that is planning for healthcare costs in retirement. A lot of times people will look at everything they want to do, and they think that Medicare is going to pay for everything, and then they start figuring out how much the premiums are, how much the Medicare gap, the deductibles on the Medicare Part D, and they don't realize that they need to have a pool of money set aside specifically for healthcare expenses in retirement, and also to pay for dental, to pay for vision, to pay for hearing aids, some things that make your lifestyle better and keep you connected to the community. People that can't hear tend to go into depression or can be more susceptible to dementia. So hearing aids are important, but they cost several $1,000s. So we always make sure that people have a plan in place to make sure they can cover their healthcare expenses and all these other things in retirement that, you could still need a crown even though it's not covered by your insurance. So I pay attention to this slide because it's pretty eye-opening. Fidelity and the Employee Benefit Research Institute have gathered just tons and tons of data from real medical costs that people over the age of 65 spend in retirement. And the Fidelity has come out with an average of $285,000 per couple. And Employee Benefit Research, it was even higher. It was $301,000 that the average married couple will spend in retirement on their out-of-pocket costs and these other items that are not covered by insurance. So it's not, if you live 30 years, that's an extra $10,000 a year. It's not really that much at the beginning, but that tends to increase every year as well. So my main takeaway here is, as part of your Medicare planning, you want to make sure that you are planning for healthcare expenses in retirement. So, and that $285,000 does not include long-term care. That does not include, if you've ever dealt with a family member going into a nursing home, it's not cheap. It's about $7,000 a month average in Tennessee for a private room in one of these facilities, and 24-hour home care is even more expensive. So these are considerations that need to be taken in when you are planning for, you know, what is it going to cost me if I want to stop working to, you know, at some point make work optional. And that's how we help people figure that out. So these are just the average cost. This came from last year. This is average across the U.S. So the private room in the nursing home, that's about $9,280 a day. It is, we live in a part of the country, and this Mid-South is less expensive than if we were in California or on the East Coast. So why would you plan for long-term care in addition to healthcare planning? To spare your family members or your children from having to take care of you, to avoid spending down assets if you're married and you wouldn't want to spend everything paying for a nursing home and then the surviving spouse doesn't have extra money to live off of, and to be able to direct your own care and get the kind of care that you want. So to close, the 3 takeaways I like people to have on the Medicare side is enroll on time. If you don't take anything else away, enrolling on time is the big takeaway. Shop carefully for your private insurance. You guys are probably not near the time yet when you need to. Most of the people that come to our workshops, you know, have 5 to 10 years average before they go, but it's important to hear this stuff so it gets planted in your brain. And especially if you still have, you know, 10, 15, 20 years that you want to work, planning for higher healthcare costs and retirement is an item that you can easily plan for if time is on your side. So thank you all for attending. That took an hour, so not bad. I'm going to stop sharing my screen. And I have no idea if, I think that recorded, but